Well, we have disease control tools, and really the major advances probably in public health have been public health measures. Clean water, adequate sanitation, decent housing, good nutrition, and importantly actually education. If you don't understand the cause of disease, it doesn't really help you go to a doctor as opposed to, say, a traditional healer who may not understand the disease either. So that, I think, is the most important thing. But then, all of these parasites are spread by blood-sucking insects, so we can control the insect population, then maybe we can prevent the spread of the disease or the transmission of the disease. And one of the most cost-effective ways of controlling malaria are insecticide-treated bed nets, which cost a couple of dollars and really can transform and are transforming the incidence of malaria in these areas. Vector control of these parasites is less efficient, without going into the details of this. The next thing, of course, would be vaccines. But two of these parasites I've mentioned are hiding inside either heart cells or macrophages, and the other one, the nice purple one, actually lives in the bloodstream, and every time it's recognized by the immune system, it changes its coat. And those that fail to change its coat are eliminated, and new coats are put on and not recognized by the immune system. So it's a battle where you get waves of parasitemia on and on. So vaccines are no good. We have no vaccines to treat these diseases. The next thing that's required are adequate diagnostics for the, first of all, to diagnose the disease, and actually also importantly, to be able to measure whether your drugs and your treatment is being efficient or not. And finally, drugs. And the two types of drugs are those that prevent the parasite getting in, prophylactic drugs, and those that can be used to actually treat the disease once the parasite or pathogen is inside you. But as I've said, the kinetoplastid or trypanosome diseases are basically tool deficient. The only thing we've got are drugs. So why then do we need new drugs? And the answer for that is that basically these drugs are not fit for purpose in a setting, a poverty setting. They don't work very well, they're poisonous, sometimes with serious side effects. This molecule here, this little chap here, is an arsenic-based drug, and it's still used to treat sleeping sickness. And 1 in 10 of patients who receive this drug will lose consciousness and go into an epileptic fit due to the toxicity on the brain, and half of those never come out of that fit. So it cures 19 out of 20 patients, but it kills 1 in 20. Now, if you had a headache and you took aspirin and you knew there was a 1 in 20 chance of dying, I don't think you would. So this is completely unsatisfactory. That's for sleeping sickness. An example of another unsatisfactory drug is the only drug that can be given by mouth. All of the rest have to be given by injection. And that's an anti-cancer drug called miltefosine, which is now used to treat this leishmaniasis, the parasite in your bone marrow, liver and spleen. And that causes harmful malformations to the developing fetus, which means you can't give it to anybody of childbearing age. And that's 50% of patients, so that's no good. And then finally, for Chagas disease, for the chronic stage, right, which I mentioned, where 10 years later you get heart problems and so on, there is no treatment, no efficacious treatment. And at the acute phase, the The drug has to be taken, this one by mouth, for at least 4 to 6 weeks, and it causes terrible side effects, and about a third of people cannot actually complete the full course of treatment.